Good evening, my dear student. So today we can discuss the topic shock, types of shock, and what are the management available for this condition. So here you can see the types of shock. The first one is hypovolemic, septic, anaphylactic, neurogenic, next cardiogenic, next obstructive, and the last one dissociative shock. The first, let us discuss what is hypovolemic shock. The causes of first you can see when the body loses too much blood or fluid. When the body loses too much blood or fluids, so it causes is the shock, and that type of shock we can call hypovolemic shock. The main reason is hemorrhage, the causes hemorrhage or dehydration. Then pathophysiology you can see here, preload decreases and contractility normal or increases, and afterload also increases. SVR stands on systemic vascular resistance. Okay. So before that you can see what is preload, what is afterload. Preload is nothing, volume of blood received by the heart. Volume of blood received by the heart we can call preload. Afterload, ejection of blood from the heart called afterload. So because of this hypovolemic shock, these two processes get affected. Preload and afterload. It means the heart can't receive blood properly and the heart can't eject blood properly because of this hypovolemic shock. Then what are the clinical manifestations you can see here? Heart rate increases, blood pressure decreases, cardiac output decreases, and capillary refill time. Capillary refill time delayed, cool extremities or pale extremities we can see, and weak pedipulse we can see. And what is the management for this hypovolemic shock is, so large bore IV fluid have to administer, and fluid resuscitation with crystalline. Have to give the treatment with mainly crystalline. Okay, the next one. Next shock, septic shock, and the causes of this septic shock is infection or sepsis. Then here also the pathophysiology preload decreases and contractility normal or decreases, or afterload also decreases. Then here clinical manifestation you can see HR increases, nothing, heart rate increases, blood pressure decreases, cardiac output decreases, and delayed capillary refill time we can see, and extremities warm and pink. Then the management for this septic shock is have to give. So here the person has the infection, so have to give IV antibiotics, fluid, and IV noradrenaline is a drug of choice. The next one, third shock, anaphylactic shock. Anaphylactic shock, the cause of this anaphylactic shock is hypersensitivity reactions. Because of hypersensitivity reaction, this anaphylactic shock will occur. And here pathophysiology, preload decreases, contractility, variable contractility we can say, and afterload also decreases. And here heart rate increases, BP, blood pressure decreases, cardiac output decreases, and capillary refill time delayed or flash, and warm extremities we can see. So here up to here whatever we have discussed, same symptoms we can see almost same symptoms we can see in hypovolemic, septic, and anaphylactic shock. Same, HR increases, here also heart rate increases, here also heart rate increases. Here BP decreases, here also BP, and cardiac output also same. Then next, the treatment for this anaphylactic shock is IV epinephrine or fluids we have to give. The next one, fourth, neurogenic shock. The cause of neurogenic shock is because of spinal cord injury or traumatic brain injury. Then here also you can see same symptoms, preload decreases, contractility normal, afterload decreases, and loss of sympathetic tone we can see. Next, symptoms you can say, neurogenic shock, HR, okay, HR decreases heart rate, and BP decreases, cardiac output decreases, and CRT, normal CRT, and warm extremities. Okay, then next one, the treatment for this neurogenic shock is eye flow of O2 need to administer, fluid resuscitation, and vasopressors has to give. The next shock, cardiogenic shock. So cardiogenic, the cause of cardiogenic shock is myocarditis or dysarrhythmia. Sorry, dysrhythmia. Okay, then the pathophysiology you can say preload decreases, contractility decreases, afterload increases in right ventricular and decreases in left ventricular. The next one here, HR increases, heart rate increases, BP increases, cardiac output decreases, and CRT delay. Then the treatment for this cardiogenic shock. Cardiogenic shock is inotropes we need to give, and fluid, and cautions use of fluids when the person has ECMO, nothing but extracorporeal membrane oxygenation. So here what it means, by this process blood is pumped outside of the body to the heart by using heart lung machine. And here this machine removes carbon dioxide in the blood and send oxygen rich blood back to the body. So this is the purpose of this ECMO. Then next shock, obstructive. Nothing but here, if the person has this ECMO device, so we have to caution before administering this fluid to that person. And here the drug of choice for this condition is cardiogenic shock, noradrenaline. The next shock, obstructive shock. The causes of this obstructive shock are, is there any tamponade in the heart, and or because of tension pneumothorax or pulmonary embolus, or because of chest trauma. And the pathophysiology you can see here, decreased preload and contractility normal, and afterload SVR, nothing but SVR increases. Then here also same symptoms we can see, except this shock, neurogenic shock, all the types of shock has the symptom increased heart rate. Okay, once you see, so except this, only this type of shock we can see decreased heart rate, and remaining all types of shock has increased heart rate. The next one, BP decreased, then cardiac output decreases, CRT delayed, school extremity we can say. And here the choice treatment choice is here pericardiocentesis and chest tube. Have to keep chest tube. So here what is meant by pericardiocentesis means the process of draining the fluid from the pericardial space to relieve the pressure in the heart is called pericardiocentesis. The next one, next shock, dissociative shock, and the cause of this dissociative shock is carbon monoxide poisoning or cyanide poisoning. Okay, and the variable pathophysiology we can see, and here also you can see same symptom, HR increases, and here BP normal or increases. So in this all types of shock, we seen that blood pressure decreases, but here this is the only type of shock, the BP increases or normal, then cardiac output increases, and next one CRT normal and extremities normal. And here also you can see cardiac output almost in all types of shock we can see decreased cardiac output except this dissociative shock. Then the treatment antidotes we need to give, and next one, hypercarbic oxygen therapy we need to provide. So nothing but by using this process, the patient get 100% oxygen by pressurized chamber. So this is the treatment for dissociative. And here in this we discussed in cardiogenic shock, we discussed inotropes are the drugs we can give for this cardiogenic. And what are the drugs included in this inotropes are digitalis and dobutamine. So once you can see the complete picture of these types of shock. Thank you. In next class we can discuss new topic. Thank you.